Hello, everybody. Good afternoon. Dr. Barry, board certified internist, founder at drprsblog.com, author, speaker, soon to be podcaster. Please be on the lookout for that. Bringing you another edition of the Lunch and Learn. First of all, I want to give special thanks for all of my live viewers who are going to be getting on in the next couple of minutes, but I also want to shout out my replay viewers as well, especially those who like and share, when they see this, 4 hours, 6 hours, the next day. Whenever you see it and you click that like button, you click that share button, your support is greatly appreciated. Today, if you've been following, we've been hitting hard the topic of heart disease, because it is Heart Disease Month, buddy, and I would definitely be remiss if I didn't focus on that. This month is also Teen Dating Violence Awareness Month as well. So I definitely wanted to kind of segue and talk about domestic violence in the workplace. Not in the workplace, but domestic violence and what that looks like when they come into the office. What's going on, Nate? Appreciate you for joining the live video. Appreciate for the like and share. Much appreciated. And again, we'll do a quick little housekeeping. We'll go ahead and share my page like I always do, and then we'll get this thing right started. Like I said, I usually have to share it on my personal page. I have a lot of my friends, and I don't know why they still have not been following my business page yet, but that's okay. We're gonna get them over there sooner or later. Okay, all right. So let's get this thing started. Again, introduce myself. Again, first of all, thank you for all the replay viewers who will be watching later on today. Thank you for all my live viewers who are going to be getting on. Today we are talking about domestic violence, an important topic, of course, especially being the father of two daughters and a son. Definitely important to want to kind of talk about this. And I wanted to kind of give my perspective on the physician aspect of it. I'm gonna give some numbers out to kind of highlight why the physician is so important in this endemic here. So we're gonna talk about in general. We're gonna talk about domestic violence, and then we'll kind of move on to the teen dating violence as well, because again, both are equally important and both affect a great number of people here. So just kind of we're throwing some numbers out here. Domestic violence most common among women between ages of 18 and 24. Only 34% of those who are injured actually will go to receive medical care, and I think that's important. One, because I don't believe only 34% actually go to the doctor, because when they see your medical care, you may be thinking just like the ER visit. But I think a lot of them are actually coming to see the doctor. But I think from a primary care standpoint, I think a lot of the primary, and I will take this, I'll take this one for the team. I think we're not asking the right question. I don't think we're asking enough questions in general, but I don't think we're asking the right questions. And a big thing with patient care, and I've talked about this, is trust. If patients don't feel, at 100% ease with you to kind of tell you all of their problems, and not just the problems that may, be like, I have a cold, or I need my blood pressure medication, but if they don't have that trust to really want to tell you everything, they're never going to. And I can tell you, I'll just do a quick story. I had a patient in my practice about a year ago, who came in. I probably saw her maybe 3 or 4 times for just very vague complaints that didn't really, make any sense, especially from a medical perspective. And I just felt like something was kind of burdening her. And I just asked her, I asked all my patients, how was everything doing? And I think from a physician standpoint, that's one of our most important questions, right? Because we don't do enough open-ended questions to kind of give patients that room to open up for us. A lot of us is, are you taking your medication? Are you seeing this so-and-so doctor? Are you doing this test? It's like either yes or no, but we're not really opening up to a lot of open-ended questions a lot of times, because, from a time standpoint, we're trying to get, from one patient to the other. I asked that question, and almost immediately you can see, especially after the 3rd visit, you can kind of see her just start breaking down, tearing. And she started telling me about the abuse at her. And fortunately, she wasn't with her husband at the time. Like it wasn't at the doctor's appointment. Started telling me about the abuse that she gets at home. Physical abuse. She started showing me pictures. She started talking about the mental, the emotional abuse that she kind of goes with on a day-to-day basis. And she would use these doctor's appointments as the way to kind of get away from that environment, whether it be for 30 minutes to an hour, but that was kind of her way to kind of escape. And fortunately, I was able to kind of get a lot of information out of her, and we were able to kind of get her the help that she needed. And even to this day, we're very fortunate because I saw her a couple months ago, and she's doing extremely well because of it. But I think that's what's going on missing. So when I see a number like only 34% receive care, like I really don't believe that only 34% are actually going to get care. I just think that when they go to see the doctor, they're not, that the doctor isn't giving them that opportunity to really say, what problems are happening. So I would definitely want to implore this post to really focus on, certain signs and symptoms that, as physicians, we should be looking for, to try to get some of this information out of there. I think as a primary care physician, we're always getting, colds, we're always getting blood pressure management and all these, different managements of cares. But a lot of times we don't really ask how our patients are doing in general. We're not really asking, how is life? We're not asking how is work. We're not asking how is the family stressors that they're dealing with. Again, I know one we talked about is from a time aspect, but I think the secondary is that we aren't doing a good enough job kind of building that trust there. And as a physician, you have to start that from the first appointment. You have to establish a sense of almost like a sanctuary when they come into your office, so they feel comfortable telling you anything when it does arise. So I think physicians, we have to be, first and foremost, we have to be very honest with ourselves. Are we doing enough to even, get some of these numbers down? And again, 1 in 3 women and 1 in 4 women have been physically abused by their intimate partner. Average 20 people are abused by intimate partners every minute. 20 people every single minute. The domestic victimization is correlated with higher rates of depression and suicidal behavior. A lot of us are seeing patients with anxiety. A lot of us are seeing patients with depression. But when's the last time we've asked is there any problems with their relationship just in general? A lot of us don't feel that we have that legal room to ask that question. Not even legal room, but just that comfortability to ask it. I mean, my patients know I got no problem if something doesn't jive and I don't feel like something's right, I'm just gonna directly ask it. Because again, that's what you're coming here for. And I have, and you can ask my office staff, I have more patients leave my office teary-eyed, but happy, but teary-eyed because for the first time they were able to kind of get some of their emotions out here. I have some patients who, when they come, it's really to kind of vent out, talk, get as much as they can so they can, move on with their day. And, I'm happy to know that I've helped kind of establish, that demeanor in my office. I do have to thank my wife. My wife's a mental health counselor, so she's big on, making sure I understand like the mental aspect of it well. Exactly, and honestly, that's a great question. I think a lot of Amanda aren't really fit for it. I think from a physician standpoint, our training is so individually focused, but it's so individually problem focused that we're not really thinking from a mental health aspect. Like, how can the mental health be affecting the reason why this person's coming in with anxiety? How can the mental health be the reason why this person may be coming in with depression? A lot of us, if we don't like physically see like bruised signs, and if we don't physically see that, we don't even chop it up as any issues going on. So I think it's definitely important from the physicians to, be very keen on, patient demeanor, be very keen on when patients come from one appointment to another. If you have a patient who's coming in multiple times and you're not really finding the answer, in a lab test, you're not really finding the answer in an image test, to really start asking these more, personal questions. Because again, there's no point for you to be going down this rabbit hole of ideas and differential diagnosis when the answer could literally be in your face. You again, a lot of patients, they'll come to the doctor, because they know the doctor is someone who should be someone to kind of take care of this thing. But again, if that doctor doesn't make that next move to try to bring it out of them, it's not going to occur. So definitely, I think, especially with a month like this where, we're teen dating violence, and I'm actually going to touch on some teen dating violence numbers because I was astonished as well. How prevalent that is. Definitely something that we need to make a concerted effort on, because we can't be depending on our mental health therapists to do all of this work. We can't depend on our patients, our victims, who are experiencing this on a day and day basis, to have enough strength and courage to just walk up to the doctor and say, hey, I'm being physically abused, mentally abused, emotionally abused. What can I do? Because the likelihood, again, 34%, the likelihood that happened is not very good. So I think we as physicians have to take an extra effort to pull out some of this information. I think we have to, and I think the first thing for us is we just have to care. If we care about our patients' well-being, these are questions that should just naturally come up. If we care about our, patients, depression, our patients' anxiety, if we see behavioral changes, we have to ask those types of questions, because those questions, could, really mean, life or death here. I'm seeing here the domestic violence accounts for 50% of violent crime. Every 9 seconds in the U.S., a woman is assaulted or beaten. I mean, these are numbers that should be so disheartening for us, right? And I can tell you, we don't have enough mental health counselors. We don't have enough mental health, professionals in the world to kind of deal with this. So, and we already know this. Numbers already show us that a patient is more likely to see their primary care doctor before they're going to see the mental health therapist. So again, like I always say, we are on the front lines of these things, and if we're not doing what we're supposed to do, to get them the care that they need, we're just as fault as the person who's doing the problem. So definitely, I want to kind of reiterate, from what we're touching on. This is Teen Dating Violence Awareness Month, but I definitely wanted to make sure I kind of encompass domestic violence, and then some signs and symptoms that we can kind of look for in the office, in the office setting, when they come to see you, in terms of very vague complaints, seeing you 3-4 times in a very short time span, but really nothing that can point to why that's happening. Changes in behavior and mood, after subsequent visits. I've had some patients where, they're happy-go-lucky the first time they came to see me, and, after the third, fourth visit, they're a totally different person. That's when it's really something that we really have to go in, full steam ahead to make sure that, this may not be a medical issue, but, how's home? How's the relationship? Are you feeling safe? I've had to ask a few patients, do they feel safe? Do they want me to call the police officers from my office for their partner? I've had to ask that. Because again, if they don't feel that you're their primary advocate, they'll never come to you, to get that help and get that information. So definitely, I implore my victims of domestic violence out there to understand that your primary care physician, whether it be internist, whether it be an OB-GYN, family medicine physician, they are there. And even for my kids, even the pediatricians, they are there to, help alleviate some of that stress. So please feel free and please feel open enough to talk to them. Because again, that's what we're here for in that regards. And again, I treat my office like your sanctuary. So whatever you want to tell me will stay in this room here. You don't have to worry about it going. Again, I've had to kick patients, I've had to kick spouses out of the rooms. I've kicked parents out of the rooms. When you're coming to see me, this is your time here. So again, definitely use your doctors to your advantage, because we're here to help. When we see these numbers like this, again, domestic violence prevalent in every community, affects every age, every socioeconomic status, sexual orientation. There's no one who's not affected by the domestic violence. And unfortunately, there's not enough mental health professionals to treat everyone. There's not enough mental health professionals to diagnose everyone. There's not enough mental health professionals to go out and seek the victims and help the victims. And I like to use myself as an extension of the mental health community, and I'm here to help as well. So please, if you're watching, or you have a friend, you have a family member who you know is going through very similar situations, please tell them, reach out. And I know there's a unfortunate negative connotation behind the mental health therapists and the mental health counselors in general, mental health period. So if you don't want to see a quote unquote counselor, go ahead and see your doctor. Go ahead and see your pediatrician, your obstetrician, and let them know, like, hey, I'm not really coming in for a medical issue. I just wanted to talk, and these are what I wanted to talk about. And before I leave, I do want to touch on, because again, this is Teen Dating Violence Awareness Month as well. Fortunately, my kids are young. I don't have to worry about it yet. I got about 14, 15 years until I got to worry about it. But so let's talk on some of these numbers. Again, this is crazy. 20% female high school students. And 14% of male high school students reported being sexually abused. And the males, again, we've talked on here before how my men feel invincible. A lot of these, this is not just a female problem, right? Domestic violence is not just a problem that only affects women. There's a lot of men who are affected by this as well. 1 in 3 women and 1 in 4 women have been physically abused by their intimate partner. 1 in 5 women and 1 in 7 men have been severely physically abused. So again, for the men out here, this is not just a problem for the women. Men are being physically abused, not at the rate that women are, but they are. So again, and remember, we have this machismo about us, so we try to act like there's nothing bothering us. So please be on the lookout as well. Men do experience some of this as well. Touching back on the teen dating violence, 1.5 million high school students are physically abused by partners every year. 1.5 million high school students. I mean, and it starts again, and I like that we're talking about the teens, because a lot of us tend to think that this domestic violence stuff kind of happens once we start getting older, and if you're an abuser, you've probably been abusing since you were a teenager. This isn't something that just comes out the wazoo, right? So this is definitely something, again, especially for my my parents who have teenage daughters, teenage sons. Definitely something you want to ask your children, because it's way more common than even I thought, right? 10% of teenage students in dating relationships coerced into sexual intercourse. 26% victims of cyber dating abuse, right? And females twice as likely as males to be victims of that. When you see people putting out their exes, nude photographs and stuff like that, that's cyber abuse. That's punishable by law. And fortunately, nobody in my family has ever experienced that, because I don't know what I would do if that was the case. 57% of teens know someone who's been physically, sexually, or even verbally abused in dating relationships. So again, these are numbers. These aren't and again, this is from the National Coalition Against Domestic Violence, right? I'll post to link to their website after. In fact, I can do that right now. I'm just going to post a link to their website right now. And again, like I said, if you know anyone, or if you know anyone who's been abused by it, it's definitely something very great site to kind of point them information to, gives them phone calls to call and people to contact in that regards. So again, this isn't an isolated problem. This isn't a thing that only affects certain people. Everyone's affected, and we just have to be mindful of noticing the signs and symptoms. Again, as a physician, my job is noticing what signs and symptoms are there. That's a very good question, because we definitely do hear about it. Very good question, man. Asking about are there men's shelters out there? I'd have to assume so. I don't necessarily know off the top of my head. I'm actually going to do my homework right after I might get off this video, because we definitely always hear about the women's shelters, but we never really hear about them. And I'd have to assume that they are. And again, I think that kind of points to, is very good, because it actually points to, even from a societal standard, where society tends not to look at men in that light from a victim standpoint, which what does that reflexively do? That makes it so that men are less likely to go seek that type of help, and they're less likely to even verbalize they even need the help. So yeah, very good question. I'm actually going to look that up, and I'll definitely answer that later today for the comments in that regard. So again, we touched on domestic violence in the office. We touched on some tips and tricks to try to, especially from a physician standpoint, try to elucidate, is there something else going on? We talked about that trust thing, that big T word that's important in the doctor-patient relationship, and if it's not there, I think it's probably the big reason why we're only getting 34% of people actually even going to seek help, because they don't even trust the professionals that are out there. To get them from point A, to the point Z. So again, and we talked about our teen dating violence numbers, which is scary, which just points out that domestic violence is not an adult thing. It's something that happens at kids. It's happening now to kids, and until we can just comfortably talk about it, it's going to keep on happening. It's going to keep getting swept under the rug over and over and over again until the worst happens. And obviously, we want to get to the point where that doesn't become the case. So again, thank you guys as always, for watching today's Lunch and Learn. Again, a little bit more of a dark mood, but that's okay. It's not all peaches and cream when you come to the doctor's office. So I wanted to make sure we touch on everything, and this specifically, especially because again, I do have a master's in public health, so this is from a public health perspective, something I definitely want to make sure that gets addressed, and something that we definitely put out there. Oh, hey, Maria, thank my wife joining on the video. Appreciate for joining. Appreciate for liking. Definitely want to make sure that's something that we wanted to kind of get out there and get information out there. I did put the website in my comments. National Coalition Against Domestic Violence. Again, if you know anyone, or if you're suffering from it, especially if you're watching this video, and some of these, things we talked about, are affecting you. It's a great website. It's anonymous, so you don't have to worry about anyone finding out, who you are, unless you want them to. And there is help out there for you. So you guys have a great weekend. I will see you guys next week for the next Lunch and Learn, and y'all have a great day. Bye.